What to expect when accessing Applied Behavior Analysis services. Applied Behavior Analysis, or ABA, is a scientific approach to supporting meaningful behavior change. ABA is used to support individuals with autism by focusing on their behavior in relation to what is happening around them. How does ABA help teach skills? First, an assessment is done to help identify goals or skills that will be meaningful to the person. Goals should reflect the individual's needs, values, and culture. Some examples of target skills include learning to play with peers, writing your name, or brushing your teeth. Skills can be broken down into smaller, more manageable steps using a process called a task analysis. Then, each step in the list is practiced until the skill is learned. Additional assistance or cues called prompts may be added to help someone complete a target skill. Some examples may include verbal, visual, or physical prompts, depending on an individual's needs and preferences. Rewards, called positive reinforcement, are used to acknowledge a person's effort and let them know that they are on the right track. Using ABA to support with interfering or harmful behaviors. When supporting an autistic person with interfering or harmful behaviors, practitioners called behavior analysts work with the individuals and their families to assess the underlying reasons for these behaviors. This is done through a functional behavior assessment. For example, the person may be trying to avoid or access something. Next, a plan is created to help the individual get their needs and wants met in an easier and safer way. With your consent, behavior analysts can also collaborate with other professionals to further support with learning and well-being. How do we know if ABA is working? First, data are collected on target skills to determine an individual's starting point, called baseline data. Data are graphed to better visualize the person's progress. Once teaching begins, data are continuously collected on the target skills to determine if the program is going well or if it needs to be modified. Programs can be adapted to keep what is working and modify or change what is not working. Choosing the right ABA provider. When choosing a provider, it is important to know that every ABA provider structures their team differently. The thing all teams have in common is that they are overseen by someone with a master's level education or higher and training in ABA. In Ontario, behavior analysts are in the process of becoming regulated healthcare professionals. Board-certified behavior analysts or board-certified behavior analysts at the doctoral level, and some clinical psychologists or psychological associates who have training in ABA can oversee ABA programs. Autism Ontario has a list of verified providers called the OAP Provider List to help you find a behavior analyst that can support you and your family. The team will include your family throughout the learning process. This is a critical step to understanding how to best support your loved one at home and in the community. Once a person meets their goals, the behavior analyst meets with the individual and their family to determine the next steps, such as discharge and transition planning. To get the most out of an ABA program, it is important that autistic people and their families ask questions, self-advocate, and get involved to ensure a learning experience that benefits them in the best way. For more information, resources, and services for the autism community, please visit autismontario.com.